Joining me now is Dr. Frita Fisher. It's good to see you, Dr. Frita. So we want to get to the why. We know that physicians have said that this is common, but this surge is not. Do you think it's the preventative measures maybe taken during COVID, and now there's what's called that immunity gap here? That's why we're seeing an influx of kids. Good morning.
Good morning, Susan. Yes, so during the height of the pandemic, we kept children locked in. We had them wearing masks, as well we should have, to prevent them from getting COVID-19. Typically, RSV will affect most children by the age of 2, but during these past 2 years, those children were not exposed. And so now you have children less than 2 getting RSV, plus the 3-year-olds, 4-year-olds, 5-year-olds, and that's leading to more RSV exposure at an earlier time than we normally see it. And it has our hospitals are really kind of turning around in circles because we are at 75% capacity of the 40,000 pediatric hospital beds in the US. So yes, being locked down and now being out has more kids exposed earlier.
And I heard a mom, Dr. Frita, say that she was listening to her daughter cough, and because she knew of this illness, the respiratory illness, she took her to the hospital, not knowing how quickly and how severe it could build. And the cough, I believe her son became unable to breathe. He is okay. So what are the signs that you can't treat this at home, you should go to the ER, to the hospital?
Yes, knowing the signs and symptoms are very important, especially since the children are typically less than 2 and nonverbal. And so you want to watch for cough, for irritability, for a decrease in appetite if children just aren't interested in food. You want to watch to see if your child is having nausea. Also, the child could have a fever and a wheeze. If you're hearing a wheezing, or if you're seeing that a child is having difficulty breathing. So if they have flaring nostrils, if they're using their neck muscles to breathe, if you can see their ribs and their stomachs are going in and out, those are all signs of respiratory distress. You don't want to wait. You want to take your child to the hospital immediately.
And there is a test, I believe, to determine if your child does have this. But in terms of recovery, if they're not in the hospital, is it just the same? Stay away from others, be at home, make sure they're well hydrated. And what about COVID and the flu shot? Because all of these respiratory illnesses are coming at once.
They are, and the symptoms overlap. So it's hard to know if it's RSV, if it's COVID, if it's influenza, unless you get tested. And most children, Susan, who are hospitalized, who need to be hospitalized, do quite well. But the issue is that if we surpass capacity, then we may have some children who don't get a chance to get treated. But yes, getting your child vaccinated with the influenza vaccine, if eligible, and with the COVID-19 vaccine will at least help to keep them from getting severely ill from some of these other preventable illnesses, since we don't actually have a vaccine for RSV. Consult with pediatricians, parents, and make sure you protect your children.
Yeah, knowing this is important for parents to know what steps to take, and we thank you. Dr. Frita Fisher, thank you.
Thank you.